Have you ever struggled to find the right word when speaking, even though you know what you want to say? Or maybe your child is 4 years old, but still can't make simple sentences like "I want water." That's when language disorder might be at play. A language disorder isn't about hearing problems or lack of intelligence. It's a struggle with understanding or using words, either spoken, written, or both. Imagine trying to read a book where all the words are jumbled. That's how confusing language can feel for someone with this condition. It often shows up early in life, but adults can get it too, especially after a brain injury. Think about it. How frustrating would it be to know your thoughts, but not be able to share them clearly? So what causes a language disorder? It's not because someone is lazy or not trying hard enough. Often it starts in childhood due to differences in brain development. For example, a child's brain might not connect words with meanings as easily as other kids. Genetics can play a role. Did your parents or siblings also struggle with reading or speaking? That can be a clue. In adults, a stroke or head injury can suddenly cause language problems, like after a car accident, where the person knows what they mean but can't form full sentences. Sometimes ongoing issues like autism or severe ear infections during early childhood can also lead to language delays. So it's like the brain's wiring for language didn't develop the usual way. How do you know if it's more than just being shy or taking time to speak? Signs include trouble naming common items, like calling a dog a barker, or not understanding simple instructions like "put your shoes on." A child might avoid talking, use short sentences, "me go," or mix up tenses, "I eated." In school, they might read very slowly or can't answer questions about a story. Older kids or adults might often pause a lot, say or thing because they can't recall the right word. Imagine trying to order food but forgetting the word burger. You might say the round meat with bread instead. That's the kind of daily frustration many with language disorder face. Diagnosis usually starts with a visit to a speech-language therapist. They don't just test vocabulary with flashcards, they watch how you interact. For example, they might ask you to describe a busy picture, like a park scene, and see if you can tell a full story. For younger kids, it might be playing a game and seeing if they follow rules given in words. Tests check both understanding and speaking skills. Once diagnosed, treatment mainly involves regular speech therapy. Think of it like training for language, practicing sentence building, word games, or using apps to improve vocabulary. Parents often join the sessions to learn how to support the child at home, like reading together every night. For adults recovering from stroke, therapy helps rebuild language paths in the brain slowly. While not all language disorders can be prevented, especially those linked to genes or brain development, early support can make a huge difference. It's like catching a learning issue early before it becomes a bigger problem. Talking to babies early, reading books, and responding to their sounds helps build language. Limit screen time and encourage conversation, like asking "what did you eat today?" instead of just showing a cartoon. For kids, regular hearing checks are important. Repeated ear infections can delay language. And in schools, watching for warning signs, like a 5-year-old who still can't tell a short story, means help can start sooner. Prevention isn't about stopping it completely, but catching it fast. Recent research is getting exciting. Scientists are using brain scans to see exactly how language areas work in real time. For example, they've found that some children with language disorders have less activity in the left side of the brain when doing word tasks. That helps target therapy better. New apps now use AI to give kids fun, personalized language games that adapt as they improve. Like a smart game that changes level when you get answers right. Also, studies show that starting speech therapy before age 3 gives the best results. In adults, brain stimulation techniques, like wearing a mild electric stimulation cap during therapy, are being tested to help recover speech faster after stroke. It's not sci-fi, It's real progress giving hope for better communication.